Hello, and welcome to my presentation on the healthcare delivery system in the United States and how it relates to issues of equity. In this video, I'll explain how healthcare in our country is organized, who delivers it, where it takes place, who pays for it, and how all of these factors contribute to either equity or inequity in our access to care. Understanding how the system works helps us see not only its strength, but also where improvements are needed to ensure that everyone receives fair and quality health care. The healthcare delivery system is made up of all the organizations, people, and actions whose main goal is to promote, maintain, and restore health. Shah and Singh describe it as the network that includes providers, hospitals, insurers, and government programs directly working together to deliver care. Knowing how the system functions is essential because it directly affects cost, access, and quality of care for patients. As Bodenheimer and Grumbach point out, understanding this structure also allows us to recognize how social, political, and financial factors influence healthcare equity across the United States. Providers are the individuals and professionals who deliver healthcare services. They include physicians, nurses, nurse practitioners, physician assistants, pharmacists, therapists, and many others who care for patients in a wide range of settings. Each provider plays a critical role in ensuring that patients receive the right care at the right time. Providers are the foundation of the healthcare system, and their actions have a direct impact on health outcomes. While providers are essential, inequities can arise from how and where they deliver care. The Institute of Medicine found that racial and ethnic minorities often receive lower quality care because of bias, stereotyping, and systemic inequities. Additionally, the Agency for Healthcare Research and Quality reports that shortages of physicians and nurses in rural and low-income areas limit the access to needed services. Promoting diversity in the healthcare workforce and providing cultural competence training are key ways to reduce these disparities and ensure fair treatment for all patients. Healthcare is provided in many different settings. These settings include hospitals, outpatient clinics, long-term care facilities, community health centers, and telehealth services. Each setting plays a unique role in meeting patient needs. Hospitals manage complex cases, while outpatient and community settings focus on preventative and routine care. Telehealth has become an important tool for increasing access, especially for people in remote or underserved areas. Unfortunately, inequities exist within these care settings. Bodenheimer and Grumbach explain that the shift towards outpatient care may disadvantage patients who rely on hospitals for comprehensive services, particularly those without transportation. Community and safety net clinics are vital in improving equity because they serve uninsured and low-income population regardless of their ability to pay. However, AHRQ notes that rural hospital closures have left many communities without access to emergency or specialty care. Expanding community-based and telehealth programs is one way to help close those gaps. The U.S. healthcare system is financed through several major purchasers: private insurance, government programs, and individuals paying out of pocket. Private insurance usually comes through employers and includes premiums, copays, and deductibles. Government programs such as Medicare and Medicaid are funded by public dollars to cover specific populations, including older adults, people with disabilities, and low-income individuals. Those without insurance often have to pay directly for care, creating significant financial barriers. How healthcare is financed directly affects equity. The AHRQ reports that people without insurance experience poorer health outcomes and face more barriers to preventative services. Medicaid expansion under the Affordable Care Act has improved access for low-income individuals, but because not all of the states adopted expansion, inequities remain. Rising out-of-pocket cost also creates financial strains for family, forcing some to delay or avoid needed care. Achieving health equity means designing payment systems that ensure everyone can afford care when they need it, regardless of income or employment. The healthcare delivery system in the United States is large, complex, and deeply connected to issues of equity. Providers, care settings, and purchasers all play important roles in determining who has access to quality care. Yet, as the Institute of Medicine and AHRQ remind us, disparities persist across racial, social economic, and geographic lines. Understanding how the system works allows us to identify where inequities exist and how we can address them. Creating a fair system will require ongoing policy reform, provider education, and community investment so that every individual, regardless of background, can receive the care that they deserve. Listed here are the resources used throughout the PowerPoint. This concludes my presentation on the U.S. healthcare delivery system and equity. Thank you for listening.